This is 20 minutes of real English practice for visiting the doctor, making appointments, describing symptoms, understanding what the doctor tells you, and picking up medicine at the pharmacy. Here's something nobody talks about. Going to the doctor is stressful enough in your own language. Doing it in English, when you're sick, when your head is pounding and you can barely think straight, that's a whole different challenge. But doctor's appointments follow a predictable pattern. The receptionist asks the same questions, doctors use the same phrases, and once you know the right words for your symptoms, suddenly the whole thing becomes manageable. Today we're covering everything from booking the appointment to walking out with your prescription. By the end of this, you'll know exactly what to say when you're feeling terrible and need to explain why. Let's start with making an appointment. Most appointments start with a phone call. The receptionist will ask you a few standard questions. And knowing what to expect makes this a lot easier. The conversation usually goes like this. You say why you're calling, they check if you've been there before, they ask what's wrong. Then they find a time that works. Let's practice the opening. Repeat after me. Hello, I'd like to make an appointment to see the doctor. Hi, I need to see a doctor as soon as possible. I'd like to book an appointment for tomorrow if possible. The receptionist might ask if you're a new patient or returning patient. Have you seen the doctor before? Are you a registered patient with us? Is this your first visit? Your response, yes, I've been there before. My last visit was about 6 months ago. No, this is my first time. I just moved to the area. Yes, I'm registered with Dr. Patel. Then they'll ask about your symptoms. They need this to know how urgent your appointment is. What's the reason for your visit? Can you tell me what the problem is? What seems to be the matter? You don't need to give details, just a general idea. I've had a bad cough for about a week. I've been having headaches and I'm worried about them. It's a stomach problem. I've been feeling sick for a few days. Listen to this complete appointment booking. Receptionist. Good morning, Dr. Wilson's office. How can I help you? Patient. Hi, I'd like to make an appointment to see the doctor, please. Receptionist. Of course. Have you seen Dr. Wilson before? Patient. Yes, I have. My name is Maria Santos. Receptionist. Let me pull up your file, Ms. Santos. What's the reason for your visit? Patient. I've had a sore throat and a cough for about 5 days. It's getting worse, not better. Receptionist. I see. We have an opening tomorrow at 2:30. Does that work for you? Patient. Tomorrow at 2:30. Yes, that works. Receptionist. Great. We'll see you then. Repeat the key phrases. I'd like to make an appointment to see the doctor, please. I've had a sore throat and a cough for about 5 days. Yes, that works. When you arrive, you check in at reception. In the US, you'll usually fill out paperwork. In the UK, things work differently. You're already registered with your GP, so there's less paperwork. Quick note on terminology. In the UK, your regular doctor is called a GP. That stands for general practitioner. In the US, people say primary care doctor or just my doctor. Same job, different names. Checking in sounds like this. Hi, I have an appointment at 2:30 with Dr. Wilson. Hello, I'm here for my 3 o'clock appointment. I'm checking in. My name is Maria Santos. The receptionist might ask you to do a few things. Please fill out this paperwork. Please have a seat in the waiting room. The doctor will be with you shortly. We're running about 15 minutes behind schedule. That last one is common. Doctors often run late. Running behind, or running behind schedule, means the appointments are taking longer than planned. Repeat these phrases. I have an appointment at 2:30 with Dr. Wilson. Please have a seat in the waiting room. The doctor will be with you shortly. When they're ready for you, the doctor will see you now. Please follow me to room 3. Dr. Wilson is ready for you. This is the hardest part for most English learners. You're not feeling well. You need to explain what's wrong, and you need the right vocabulary. Let's start with how doctors ask. What brings you in today? How can I help you? What seems to be the problem? How are you feeling? Your answer should include three things: what you feel, where you feel it, how long it's been happening. The structure is simple. I have or I've been having. Repeat these symptom descriptions. I have a headache. I have a sore throat. I have a cough. I have a fever. I have a stomach ache. I've been having back pain. I've been feeling dizzy. I've been feeling tired all the time. Notice the grammar. I have is for right now. I've been having or I've been feeling shows it's been going on for a while. Add the duration. I've had this headache for 3 days. I've been coughing for about a week. My throat has been sore since Monday. This started 2 days ago. Listen to how a patient describes their symptoms. Doctor: good afternoon. What brings you in today? Patient: I've been feeling really unwell. I've had a bad headache for about 4 days and my throat is really sore. I've been coughing a lot too, especially at night. Doctor: I see. Do you have a fever? Patient: I think so. I've been feeling hot and cold. Repeat the key phrases. I've been feeling really unwell. I've had a bad headache for about 4 days. My throat is really sore. I've been coughing a lot, especially at night. Doctors need details. Saying it hurts isn't enough. They want to know what kind of pain, how bad, and when it happens. Types of pain: sharp pain, sudden and intense, like a knife. Dull pain, constant but not intense, like a weight pressing down. Throbbing pain, pulsing, like a heartbeat. Burning pain, feels hot, like fire, aching. Deep, steady discomfort. Repeat these descriptions. I have a sharp pain in my chest. It's more of a dull ache. My head is throbbing. There's a burning feeling in my stomach. My back has been aching for weeks. Doctors often ask you to rate your pain on a scale of 1 to 10. 1 means barely noticeable. 10 means the worst pain you can imagine. On a scale of 1 to 10, how would you rate the pain? Your answer? I'd say it's about a 6. Right now it's maybe a 4, but last night it was an 8. It varies. Sometimes it's a 3, sometimes it's a 7. Other useful descriptions: it comes and goes. It's constant. It never stops. It gets worse when I lie down. It gets better when I rest. The pain moves around. It's always in the same spot. Listen to this detailed symptom description. Doctor: can you describe the pain for me? Patient: it's a sharp pain right here in my lower back. It's been there for about 2 weeks now. Doctor: on a scale of 1 to 10? Patient: usually about a 5, but when I bend over, it shoots up to an 8. Doctor: is it constant or does it come and go? Patient: it's pretty much constant, but it gets worse in the morning when I first wake up. Repeat after me. It's a sharp pain right here in my lower back. Usually about a 5, but when I bend over, it shoots up to an 8. It gets worse in the morning when I first wake up. Let's practice vocabulary for the most common reasons people visit the doctor. A cold. I have a cold. My nose is blocked. I have a runny nose. I keep sneezing. I've got a slight cough. The flu. I think I have the flu. I've had a high fever. My whole body aches. I have chills. I feel exhausted. Note the difference. A cold is mild and you can usually keep working. The flu knocks you out. Body aches, high fever, extreme tiredness. If your whole body feels like you've been hit by a truck, that's probably the flu. A stomach bug. I've got a stomach bug. I've been throwing up. I've had diarrhea. I feel nauseous. I can't keep anything down. An ear infection. My ear really hurts. I have an earache. My ear is blocked. I can't hear properly out of my left ear. An allergic reaction. I think I'm having an allergic reaction. I've come out in a rash. My skin is itchy. My eyes are watering. I'm sneezing constantly. Practice these in full sentences. I've had a cold for about a week. My nose is blocked and I keep sneezing. I think I have the flu. I've had a high fever and my whole body aches. I've got a stomach bug. I've been throwing up since yesterday. Doctors will examine you and ask follow-up questions. Knowing what to expect helps. During the examination, I'm going to take your temperature. Let me check your blood pressure. Can you open your mouth and say ah? I'm going to listen to your chest. Take a deep breath. Does it hurt when I press here? Can you lie down on the bed, please? Just relax your arm. Follow-up questions? Have you had this before? Are you taking any medication? Do you have any allergies? When did the symptoms start? Have you traveled recently? Is anyone else in your family sick? Practice answering these. No, this is the first time. Yes, I take blood pressure medication. I'm allergic to penicillin. It started about 5 days ago. No, I haven't traveled anywhere. Yes, my daughter had something similar last week. The allergy question is important. Repeat this phrase. I'm allergic to penicillin. Or whatever you're allergic to. Doctors need to know this before prescribing anything. After examining you, the doctor will explain what they think is wrong. This is called the diagnosis. Common phrases. It looks like you have. I think this is. It sounds like a case of me. You've probably got. I'm fairly certain this is. For example, it looks like you have a throat infection. I think this is just a viral infection. A common cold. It sounds like a case of food poisoning. You've probably got a mild ear infection. If they're not sure, I'd like to run some tests to be sure. I'm going to refer you to a specialist. Let's do some blood work. I want to send you for an X-ray. Questions you can ask. Is it serious? Is it contagious? How long will it take to get better? Will I need to take time off work? Listen to this diagnosis conversation. Doctor, well, I've examined you and I'm fairly certain you have a chest infection. Patient, is it serious? Doctor, no, not serious, but you'll need antibiotics to clear it up. Patient, how long until I feel better? Doctor, you should start feeling better within a few days of starting the medication, but finish the whole course. Don't stop just because you feel better. Patient, okay, is it contagious? Doctor, it can be, so try to avoid close contact with others for a few days. Repeat the key phrases. I'm fairly certain you have a chest infection. You'll need antibiotics to clear it up. You should start feeling better within a few days. Finish the whole course. Doctors give instructions about how to get better. Sometimes it's medication. Sometimes it's rest and fluids. Sometimes both. Common treatment phrases. I'm going to give you a prescription for. You'll need to take antibiotics. Take this medicine 3 times a day. Take it with food. Take it on an empty stomach. Drink plenty of fluids. Get lots of rest. Stay home for a few days. Come back if it doesn't improve. Dosage instructions. Take 1 tablet twice a day. Take 2 pills every 4 hours. Apply the cream 3 times daily. Take 1 before bed. Duration. For 7 days. Until the symptoms go away. for 2 weeks, until you finish the whole bottle. Questions you should ask. How many times a day should I take it? Should I take it with food? Are there any side effects? Can I drive while taking this? Can I drink alcohol while on this medication? Practice these dialogues. Doctor, I'm going to give you a prescription for antibiotics. Take 1 tablet twice a day for 7 days. Patient, should I take it with food? Doctor, yes, take it with meals. It can upset your stomach otherwise. Patient, are there any side effects I should know about? Doctor, some people feel drowsy, so don't drive until you know how it affects you. Repeat after me. Take 1 tablet twice a day for 7 days. Should I take it with food? Are there any side effects I should know about? You've got your prescription. Now you need to pick up the medicine. In the UK, this happens at a chemist, though most people just call it a pharmacy now. In the US and Australia, it's always a pharmacy. Handing in your prescription. Hi, I have a prescription to fill. I'd like to get this prescription, please. How long will it take? The pharmacist might say, it'll be ready in about 15 minutes. Take a seat, we'll call your name. We don't have this in stock. Can you come back tomorrow? Picking up your medicine. I'm here to pick up a prescription for Santos. The name is Maria Santos. Paying for medicine varies a lot by country. In the UK, on the NHS, prescriptions have a fixed charge, currently about £9. In the US, it depends on your insurance. The pharmacist might ask, do you have insurance? That'll be $12. There's a generic version that's cheaper. Would you like that instead? Generic means a cheaper version of the same medicine, same ingredients, same effect, just not the brand name. Yes, the generic is fine. Over-the-counter medicine doesn't need a prescription. You can just buy it. Do you have something for a headache? What do you recommend for a cold? I need some cough syrup. Do you have anything for an upset stomach? The pharmacist might ask about your symptoms. Is it a dry cough or a chesty cough? How long have you had the symptoms? Are you taking any other medication? Listen to this pharmacy conversation. Patient. Hi, I have a prescription to fill. Pharmacist. Sure, let me take a look. This will be ready in about 10 minutes. Is that okay? Patient. That's fine. I'll wait. 10 minutes later. Pharmacist. Ms. Santos? Your prescription is ready. So this is an antibiotic. Take 1 pill twice a day, morning and evening. Finish the whole course, even if you feel better. Patient. Should I take it with food? Pharmacist. Yes, take it with meals to avoid stomach upset. Patient. Thank you. Repeat after me. I have a prescription to fill. Take 1 pill twice a day, morning and evening. Finish the whole course, even if you feel better. Sometimes the doctor wants to see you again. This is called a follow-up appointment. What the doctor might say, I'd like to see you again in a week. Come back if you're not feeling better in a few days. Make a follow-up appointment for 2 weeks. Let me know if the symptoms don't improve. Scheduling a follow-up. I need to make a follow-up appointment. The doctor asked me to come back in 2 weeks. I'd like to book a follow-up for next week. At the follow-up, I'm here for a follow-up appointment. The doctor wanted to see me again to check how I'm doing. If you're feeling better, I'm feeling much better, thanks. The medication worked really well. My symptoms have cleared up. If you're not better, I'm still not feeling great. The symptoms haven't improved. It's actually gotten worse. The medicine didn't seem to help. Listen to this follow-up conversation. Doctor, how are you feeling since your last visit? Patient, much better actually, the cough is almost gone. Doctor, good, good. And the fever? Patient, that went away after a couple of days. Doctor, excellent. It sounds like the antibiotics did their job. Are you still taking them? Patient. Yes, I have 3 more days left. Doctor. Good. Make sure you finish the whole course. Is there anything else bothering you? Patient. No, I think I'm fine now. Thank you, doctor. Repeat the key phrases. Much better, actually. The cough is almost gone. That went away after a couple of days. I have 3 more days left. Sometimes you can't wait for an appointment. You need help right now. In the UK, call 999 for emergencies. You can also call 111 for urgent but non-emergency health advice. In the US, call 911 for emergencies. For non-emergencies, you might go to an urgent care clinic. In Australia, call 000 for emergencies. Describing an emergency: I need an ambulance. Someone has collapsed. They're having trouble breathing. They're having chest pains. There's been an accident. I think they're having a heart attack. They've lost consciousness. At the emergency room, in the UK it's called A&E, which stands for Accident and Emergency. I need help urgently. I'm having severe chest pain. I can't breathe properly. I've been in an accident. They'll ask questions quickly. What happened? How long has this been going on? Are you allergic to any medications? Where does it hurt? Practice these emergency phrases. I need an ambulance. Someone has collapsed. I'm having severe chest pain. I can't breathe properly. For less urgent situations where you still need same-day care, I need to see a doctor today. It's urgent. Is there any way to get an emergency appointment? Can the doctor see me if someone cancels? Let's practice a complete doctor visit for a common situation. A bad cold that won't go away. Booking the appointment. Receptionist. Good morning, Dr. Chen's office. Patient. Hi, I'd like to make an appointment, please. Receptionist. Of course. Are you a registered patient? Patient. Yes, my name is James Taylor. Receptionist. What's the reason for your visit, Mr. Taylor? Patient. I've had a really bad cold for over a week and it's not getting better. Receptionist. We have an opening tomorrow at 11:15. Would that work? Patient. Yes, that's perfect. At the appointment, doctor. Good morning, Mr. Taylor. What brings you in today? Patient. Hi, doctor. I've had this cold for about 10 days now and it's just not going away. My nose is completely blocked, I have a terrible sore throat, and I've been coughing constantly. Doctor. I see. Any fever? Patient. I had a slight fever at the beginning, about 38 degrees, but that's gone now. Doctor. Any body aches or chills? Patient. A little bit of achiness, but nothing too bad. Doctor. Let me take a look at your throat. Open wide and say, ah. It's quite red and inflamed. I'm going to listen to your chest as well. Take a deep breath. And again. Patient. How does it sound? Doctor. Your lungs sound clear, which is good, but your throat is definitely infected. I think what started as a viral cold has developed into a bacterial throat infection. Patient. Do I need antibiotics? Doctor. Yes, I'm going to prescribe a course of antibiotics. 7 days. Make sure you finish the whole course. Patient. Should I take time off work? Doctor. I'd recommend resting for a couple more days if you can, and drink plenty of fluids. At the pharmacy. Patient. Hi, I have a prescription to fill. Pharmacist. Sure, let me see. This will be about 10 minutes. Patient. That's fine. Later. Pharmacist. Mr. Taylor, here's your medication. Take 1 tablet 3 times a day with food. Finish all the tablets even if you feel better. Patient. Any side effects? Pharmacist. Some people get an upset stomach. Taking it with food usually helps. Patient. Thanks. Different situation. Food poisoning or a stomach bug. Doctor. What can I help you with today? Patient. I've been really sick since yesterday, vomiting, diarrhea, stomach cramps. I think it might be food poisoning. Doctor. When did it start? Patient. Yesterday evening, around 8 p.m., I'd had dinner at a restaurant about 4 hours before. Doctor. Have you been able to keep any food or water down? Patient. I managed to drink some water this morning and keep it down, but I haven't eaten anything. Doctor. That's actually okay for now. The most important thing is staying hydrated. Small sips of water. You can try electrolyte drinks too. Patient. Do I need any medication? Doctor. Food poisoning usually clears up on its own within a few days. I don't want to give you anything to stop the vomiting or diarrhea. Your body is trying to get rid of something bad. Patient. So I just wait it out? Doctor. Yes, but there are some warning signs. If you see blood, if the fever goes above 38.5, or if you can't keep any water down for more than 24 hours, Mariam, come back or go to urgent care. Patient. How long until I feel better? Doctor. Most people feel significantly better within 2 to 3 days, but you might feel weak for up to a week. Repeat the key phrases. I've been really sick since yesterday, vomiting, diarrhea, stomach cramps. The most important thing is staying hydrated. Food poisoning usually clears up on its own. Most people feel significantly better within 2 to 3 days. Let's review the most useful phrases from today. Making an appointment. I'd like to make an appointment to see the doctor. I've had symptom for time period. Arriving. I have an appointment at 2:30. I'm here for my appointment. Describing symptoms. I have a headache slash sore throat slash cough slash fever. I've been feeling dizzy slash tired slash nauseous. The pain is sharp slash dull slash throbbing. On a scale of 1 to 10, it's about a 6. Duration. It started 3 days ago. I've had this for about a week. It's been getting worse. Doctor's questions. Have you had this before? Are you taking any medication? Are you allergic to anything? Understanding treatment. Take 1 tablet twice a day. Take it with food. Finish the whole course. At the pharmacy, I have a prescription to fill. Do you have something for a headache? Follow-up. I need to make a follow-up appointment. I'm feeling much better. That's everything. Making appointments, describing symptoms with the right vocabulary, understanding what the doctor tells you, picking up medication at the pharmacy, and handling follow-up visits. The trick with doctor visits is knowing what to expect. Receptionists ask the same questions every time. Doctors follow a pattern: symptoms, examination, diagnosis, and cause. Treatment. And pharmacists want to make sure you take the medicine correctly. One thing I want to emphasize: if you're allergic to any medication, memorize how to say it. I'm allergic to penicillin could be one of the most useful phrases you ever learn. Practice these phrases out loud. Write down your symptoms before your next appointment. And don't be afraid to ask the doctor to repeat something or explain it differently. They're used to it. Thanks for practicing with me. I hope you feel better, and I'll see you in the next episode.